today. We are coming to you live from Changes Plastic Surgery, and I have three beautiful women that are going to also be a part of this IG Live. We're going to start off with our beautiful RN Ari, and she's going to talk about some skincare treatments. And my name is Charlotte White. I am the account executive for Zeo Skin Health, and you are tuning on because, as promised, we are going to talk about anti-aging and brightening solutions. A new year, beautiful skin for you. So let's just jump right into it. We also have people from the team that are online that are going to be able to answer some, field your questions. We're also taking down everyone's name, so you do have some benefits for joining in live. Make sure you DM us and let us know that I attended the live special for extra incentives and discounts. So let's go ahead and get started. We're also going to be answering some questions, and we're going to try to keep this nice and short and sweet and be cognizant of everyone's time. So anti-aging. I personally, I don't know about you, I think aging is a gift. So I want to live to be a very, very old woman. I just want to look the very best. And so and when it comes down to aging, there are three key factors that causes our skin to age. It's not all genetics. Genetics is one key component, but it's also environmental as well as mechanical. So sleeping on your side, frowning and fussing at people all the time, or just over time, just that the gravitational pull will start to cause some visible signs of aging in our skin. And as an industry, what we're finding is that our baby boomer generation, so those born between 1946 and 1964, they want to restore, right? Would you agree? They want to restore and erase some of the visible etchings on the skin. Then our Gen X, those are those born between 1965 and 1980. I fall into that range. We want to maintain, but then we also want to not only maintain, we want to prevent as well as restore. But it's not just us that are coming in. Our Gen Y and millennials make a huge component of our group. So those are people that are born between 1981 and 1996. So this is just kind of this segment is going to address all three of those levels of anti-aging in the skin. So our whole goal when it comes to aging is collagen, 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 collagen and elastin. And we also want to have that visible glow to the skin. So the first sign of aging on the skin, what do you think it is? This is kind of rhetorical, obviously. I wish we were live in person. But since we're not, it is kind of rhetorical. But the very first sign of aging on the skin is dullness. So it's not even with that wrinkle. It's when your skin starts to look dull and you don't have that glow. That's when you know it's time to start seeking in some medical skincare and exfoliating those skin cells. So that's the first key. And then we start to see pigmentation is a sign of aging. We start to see our pores start to look larger. This is because we're starting to lose elastin in the skin. And then, of course, we all know about the fine lines and wrinkles. And the reason why this happens, I wanted to show you this little diagram here. So when we're nice and young and baby skin, this is a little example of what healthy skin is. The top layer of skin is our epidermis. That is the layer that we actually see. The dermis is the layer that has all of the good stuff, the collagen, the elastin, the good blood flow. And these two segments are held together by what we call a epidermal junction. They zip those two together, and that's when our skin is nice and tight. But as we age, a couple of things start to happen. Number one, we don't exfoliate our top layer of skin cells, thus the dullness starts to happen. Number two is we stop producing, we still always have those cells, but those fibroblast cells are not producing collagen and elastin like they used to. And then number three, we start to see this beautiful line with these deep planes. It starts to flatten. And as that starts to flatten, we start to get that gravitational pull, the sagging and the jowling of the skin. The fourth thing that happens is our pigment cells, which are found right around here, those pigment cells start to offshoot discoloration, and we start to see the assaults from the sun. They start to surface up. So that's why most of us around our 30s, sometimes in our 20s, depending on birth control pills or whatnot, we start to see significant pigmentation in the skin. So I like to just show a little story as to what's happening and what we can do to combat it. So I like to think of skincare. This is a really good analogy someone told me. Coming in to see Ari and Shanae, that's like going in to see your dentist. You need to see your dentist regularly, all the time. However, not using skincare is the equivalent of not brushing your teeth. Yeah. So just seeing your dentist and not brushing your teeth, that's not going to quite cut it. And the same holds true when it comes to skincare. So when we're looking at anti-aging, if we're going to just try to prevent, there are some key factors that you need. A good cleansing system in the morning. This is really the cornerstone and the foundation for all conditions of the skin. Cleansing your skin AM and PM. Everyone always forgets the morning, but it is so important because the oils on our hair and just overnight, those dead skin cells, cleansing with the cleanser is important. So don't forget that morning cleanse. And please don't go to bed with makeup on. Ooh, that'll wake me up out of a dead sleep. The next key phase is using an exfoliant, because remember, our skin starts to look dull. So we want to have that glow. We want to help to move those skin cells along. And that by using a toner, not only are we restoring the pH, but it allows all of our products to penetrate deeper in the skin. So I'm going to tell you right now, take out a pencil. This is step one. You want to start with a good cleansing system. To prevent, we also want to, for those that don't really have deep fine lines and wrinkles, but you want to maintain what you have, make sure you have your nice supple skin. Our Daily Power Defense is a powerful antioxidant that we recommend that you use in the morning. It's going to help to boost the efficacy of your sunscreen, and it's going to help to thicken your epidermis and help to prevent your skin from showing those visible signs. But then sometimes we know that depending on what age we start skincare, we might need a little bit more. So now we're going to move into the restoring for skincare. You know what, actually, before we start there, to prevent, okay, I'm going to have Shanae come on in briefly.
Okay.
Shanae is our beautiful medical esthetician.
Hi.
And what age would you recommend that people come in and start getting facials?
As young as a teen.
Absolutely, because teaching those good habits is definitely going to keep our skin looking better. And then what are some treatments so to prevent? Say I'm coming to you, I'm starting to get the dullness, some minor fine lines. What is the treatment that you recommend for me?
I do either the hydrofacial or the ZO. It be a little more aggressive, but the hydrofacial is great because it helps lightly, gently resurface the skin, but it also is very results driven. And then we can infuse it with one of the boosters of the ZOs.
That's perfect. How many of you have had a hydrofacial out there? If not, you definitely need one, and we're going to be talking about specials. Stay tuned to the end because we're going to bring in the practice manager to talk about all the specials that are available to you. But hydrofacial is a phenomenal treatment. And how often should one get a hydrofacial? I
say like once a month, 3 to every 4 weeks, just because you really need that rejuvenation. It's that light exfoliation. We're also infusing with a lactic acid, glycolic, and then we do a little work to flush out this pores and sterilize it, and then we're coming in with our boosters, which is for our ZO, is we have the Rosatrol, and we also have the Bright Alive, which is my personal favorite for the hyperpigmentation. And then we come in and we do like another antioxidant infusion with like hyaluronic acids and peptides and antioxidants.
Perfect. So come in, get that facial along with your skincare. You are preventing as well as correcting some visible damage, and we're all back in the mask, right? So in addition to aging, some of us are even getting congested again, even way past menopause. Doesn't matter, we're still getting congested. So that cleansing system along with the facial is going to help to keep your skin nice and clear and alleviate that congestion in your skin. So now that next phase, let's talk about my age group, okay, the Gen Xers. Now, we range, and we range in terms of age, and some of us actually are starting to have some visible lines at rest on the skin. So now we need a little bit more. So Ari, in addition to facials, Now we might start looking at Botox, a little filler, and then there's other treatments that we can start to use too, which I'll have her talk about shortly. But in our home care regimen, now we want to add in growth factor serum. This is Dr. Lee's favorite ZO skincare product.
It's one of the best.
It's one of the best. It's one of the best. And the reason why we love growth factor is because it uses plant-derived growth factors to upregulate that collagen and elastin. Remember that picture that I showed you, how it starts to flatten out? This is going to awaken those cells and make your skin juicy and plump. We also have a beautiful eye serum with a nice cooling tip applicator that goes along with it to significantly reduce crow's feet and those little tiny lines here that a nurse can't feel. This is going to help to plump that area. So these two are a definite must. They also have an ingredient that helps to hinder muscle contraction. So if you're getting Botox and filler, I like to call this your injectable insurance because it helps those treatments to last even longer in the skin. We love it. And for those that don't want to have any treatments, I want to show you a woman that started using skincare, but she didn't want to do anything in the clinic. She was a little afraid. So this was her before picture. This particular client is 53, and she didn't really do much for the skin, not even sunscreen. But after 9 weeks of using growth factor and our firming serum, this is how her skin looks. So we see that we have a significant lifting of the jowling. Her nasolabial fold is really plump. Even look at her lips. She did not have any filler, and now she wants to get some filler because her skin looks so amazing. So now she wants to fill. But even her lip, her vermilion border was restored just because that collagen was ignited. So growth factor, firming serum, a definite must. What I love about ZO is we like to make it easy for you. We have the growth factor featured in a kit. So it has your cleansing system, it has the daily power defense, as well as growth factor. And this is going to be a special deal just for today only, I believe.
Correct.
Yes. All of our ZO products.
All ZO products, but these are the ones that we're highlighting.
And then I like the eye growth factor, especially for all of our bluff patients.
Oh, that's huge.
A big one, and it helps with that eye exercise that we end up doing or telling you to do. You could also utilize this as well with that.
Oh, see, thank you. And Dr. Lee is known worldwide for his bluffs, so that's a definite must as part of your post-treatment system, and even pre-treatment too. It's good to help to get your skin conditioned because it's hard to get into Dr. Lee. So while you wait, you might as well get your skin looking beautiful. Next product I love to talk about is firming serum. So we talked about jowling and especially the neck area, right? Now this is something I find, it doesn't matter how old you are, I start to find we have the tech neck, we're on computers so much, we start to get that horizontal line in the neck, and then this jowling where you look up one day and you're thinking, where did that happen? So firming serum is preventative. It also helps the skin to heal post-treatment. So when Ari talks about some of the more aggressive treatments that you can do for the skin, this is amazing to use post-treatment, and it's going to help to make that jawline nice and tight. So using firming serum with the anti-aging kit is a perfect way to start off your new year if anti-aging is your primary concern. So is there anything else that you would like to, chemical pills too. So in addition to hydrofacial, when we start to have more texture to our skin, deeper fine lines and wrinkles and congestion, we do offer our ZO 3-step chemical pill. And that pill is performed by Shanae.
It is, and what I love about it is it's meant for all skin types. So it's safe to use and you get to great results in the end.
Yes, and that's one question I get asked all the time, especially for those of us girls that have a little bit more pigment in our skin. Is this safe for me? These treatments that we're talking about are good for all Fitzpatrick. So yes, it is an option for you as well. And we always precondition your skin to make sure that you get optimum results. So Shanae, thank you so much. Thank you so much. I'm going to actually bring in Ari. And now we're going to start to talk about some of the more advanced concerns. So I want to show you this particular picture of a patient. This is one of our doctor's mothers, and she is 73. So we understand that aging doesn't come just in a fine lines and wrinkles. Sometimes we have pigment and fine lines and wrinkles. But this is to show the beauty between at-home skincare as well as in-clinic treatments. And Ari is going to talk about one in particular that's on special today, which is called Morpheus 8.
Yes, so our Morpheus 8 treatment is one of our most popular treatments here at Changes. The reason being is it is a great treatment for almost anyone. This treatment particularly creates a controlled injury to the dermis, like Charlotte was talking about, where all of that collagen lives. Everything that creates that plump, youthful look to the skin. And that controlled injury helps to stimulate new collagen and elastin. So over time, it helps with fine lines, pore size, just overall, it can help remodel some of the tissue like the jowl area or the submentum, that heaviness that we sometimes see under the chin area. And it has radio frequency, which also helps to firm and tighten the tissue. We typically recommend 3 treatments spaced about 4 to 6 weeks apart. And as Charlotte was saying, this is an investment, and I recommend to patients to achieve the ultimate result and to preserve that result. You really need to get on a good skincare regimen. So I typically recommend the firming serum for afterwards because it is indicated for post-procedure, as well as the hydrating cream. It adds a lot of great hydration because sometimes people can feel a little dry, a little kind of rough afterwards, and that particular product works beautifully with this treatment.
That is awesome. Thank you so much.
You're welcome.
And I love it too because you're not introduced, and it has the radio frequency
Yes.
component to it, right?
Correct.
So you're getting so much for value for that session. And how many treatments do you recommend of Morpheus?
Typically, we recommend 3,
Okay.
spaced about 4 to 6 weeks apart. And it is very low downtime, very little social downtime. You're red for maybe 24 to 48 hours, and then you may experience a little dryness after that, but you can even put makeup on 1 to 2 days later. So this isn't something that you need to, take time off work or not see friends or have dinners or things like that. It's a really great in-office treatment for someone who's concerned about social downtime.
That is perfect. And one amazing combination that I've seen with practices is maybe doing Morpheus 1 month, then doing a chemical pill the next month, then doing Morpheus. So then you have really half of 2022, you have a full treatment plan with your hydrofacials sprinkled in, and they will customize a treatment plan just for you so that as you're coming in, you know exactly where you're going. And the results of the 2 of those, because it's pigment, congestion, excess redness, fine lines, and wrinkles, it looks comparable. I've seen people look 10 to 15 years younger with combining those 2 treatments. So I think that would be a beautiful option for some of you. And then we're talking about our baby boomers. So that would be a great combination for our baby boomers. And then also incorporating vitamin A or retinol in your regimen is key. So we're ready to talk about pigment, but I put the retinol in between because retinol is truly the key. The trifecta for anti-aging is sunscreen, vitamin C in the morning, and a vitamin A at night. Those 3 are bare minimum, amazing for everyone to use, but retinol really helps to restore the dermis, as both Ari and I have talked about, and the dermal layer as well. So it's upregulating those cells, making your skin strong and healthy. It also helps to promote some natural hydration within, because as we age, we notice that our skin starts to feel a little drier, right? We start to kind of evaporate some of the natural hydration that we have within, and retinol is going to help to upregulate that as well. So this is a key component to not only anti-aging, especially with deep fine lines and wrinkles. Our wrinkle and texture repair also has some of the firming complex. So with our wrinkle and texture repair, you're getting the best of everything, including some of the firming as well as refining the texture of your skin. And before doing a treatment such as Morpheus or even the chemical pill, we recommend that you're off of this for a good 3-5 days optimal so that they can go as deep as they need to and you get the best from your in-clinic treatment. So, and also quick question, is Morpheus good for pigmentation?
It can help with some pigmentation. I have seen that with patients. It is actually good for most skin types, including darker skin types. But usually what I recommend is patients pre-treat with the ZO. pigmentation products, just to ensure that they get the best results and the safest treatment. So yes, you can do it on most skin types, but I do just pre-treat for those darker skin types, and that can help with pigmentation as well. People will see a result just from those products alone.
I love that. I love that. And one thing I know with treatments such as Morpheus or microneedling is that, let's look at that melanocyte cell. So we're going to jump into pigmentation. Again, we want to be cognizant of time. But all of us have this little cell that resides down there in the bottom of our epidermis, the top layer of skin. This cell provides color to our skin. So the interesting thing is they say most humans are born with the same amount of melanocyte cells. I don't know who took time to count that, but that is what they say. But what dictates our skin color are the size of these little granules. They're called melanosomes, and those melanosomes fill up our skin cell. So my melanosomes are more like jelly beans. They completely fill up the skin cell. They let in less light. Thus my skin is darker. Ari's melanosomes are more like pebbles, so they let in a little bit more light. Her skin is lighter, and so forth and so on. But the darker our skin is, this little cell is a type A overachiever. It actually provides a little umbrella over the mitochondria of every cell, so it actually helps to protect us from the sun. But the more pigment you have, the more type A this cell kicks in. So even a little bump or a scratch can cause what we call post-inflammatory hyperpigmentation. So the way that when you're coming in for treatments, and it's always good to see a skin health professional, because you might have blonde hair and blue eyes out there, but based on your ethnic components, if you have knowledge of that, you might have Native American, you might have some Latinx. We don't know just by looking at you, and you can produce pigment as someone who's a few shades darker. So it's always good to get a consultation prior to these treatments. And we have this tremendous pigment kit along with the wrinkle and texture repair. This is what we use to pre-treat the skin. So you have a good system a couple of weeks before your treatment, and then you still have product left over to take care of your skin after your skin is healed. So we make it so easy for you to have safe and effective results. But when it comes to pigment, not everyone needs to go on hydroquinone. Now for treatments, and if you have melasma, absolutely. And I want to just talk about the different types of pigment. When you come into us, you guys always, most people say dark spots, but we're looking at the type of spots that you have. So for those of you that might still break out, and after each single breakout, you have a little scar left, that's called post-inflammatory hyperpigmentation. The only good thing about that type of pigment is unless you get a scar or a lesion in that same place, once that scar is gone, it does not usually resurface. And because it's pretty recent, that's just that little melanocyte cell trying to protect you, we can easily treat that with a non-hydroquinone option such as Bright Alive. Bright Alive does not have any hydroquinone or retinol, but it does feature a powerful ingredient called tranexamic acid, or TXA. Dermatologists love it because it just knocks out that cell from turning on. So it effectively brightens the skin, and it's even gentle if you're pregnant or lactating. So this is a great solution for mild pigment. And here's an example as to how well Bright Alive works. So this is our baseline. This patient, you can even see that little dark spot. A dark spot, and after 12 weeks, with just about one bottle, you can see that not only is that reduced, but also the redness in the skin is also diminished. So Bright Alive works on both redness, post-inflammatory, and sun damage. You use it morning and night. It brightens everyone's skin tone. So anyone concerned with any form of pigment, this is a great starting place.
That's one of my personal favorites, actually.
Isn't it nice?
Yeah.
And it's gentle, and it smells so yummy.
It does.
But then we know that pigment sometimes can be a little bit more aggressive. So sometimes we have sun damage, and then even we have patients that might have a lot of freckles. Sometimes I think freckles are super cute. So sometimes patients want to keep the freckles. You don't want to go on hydroquinone. But if you do want to erase those freckles, then you would go on a stronger product. But then there's people that we understand not everyone is going to go on hydroquinone. So we have one of the strongest non-hydroquinone treatment plans available to you. So this patient was on hydroquinone for too long, over 10 years, wasn't being monitored, and her pigment started to settle in, and we've seen that before. So you don't want to stay on hydroquinone forever. You're only going to be on it for about 5 months, and you cycle on and off. But this is her result after 9 months. What she used was our retinol skin brightener in the morning. Love this product. It was recently reformulated with bukuki oil, so it's not irritating, but you're getting a tremendous brightening. It can even help to arrest melasma, which is the deepest form of pigment that we have in the skin. It just takes a little bit longer than using a hydroquinone. But you can do this in conjunction with the 3-step pills, and then you can use your wrinkle and texture repair at night. So morning and night help to yield the before and after picture that we see here, along with 3-step pills. And let's talk about melasma. So sun damage is freckles, the little spots that we see on the skin, but this is the one that's so hard for many of us. Melasma has clear, distinct pattern. You usually see it on the forehead, both of the cheeks, and the upper lip. And melasma, there's no cure for melasma. I want to be really transparent with that, but we can make melasma to where it's virtually undetectable with the naked eye. So by, again, coming in, 3-step pills are phenomenal, but you are definitely going to need home care because melasma is closely interlinked to our estrogen production. So we usually start to see it pre and post pregnancy or birth control pills. That they don't tell you that when they first get. They don't tell us. So I remember having so many young patients come to me in their 20s with melasma saying, where did this come from? And it's usually birth control pills. So our pigment control kit is a prescription level hydroquinone, and this kit will last you for about 2.5 months. This is a picture of a patient from one of our clinics. This is 1 month result from just using the pigment, from using the kit alone. So we have great brightening, but then she also had 1 3-step pill after this particular result. But this is pretty phenomenal from skincare. But as stated, you need to stay on the pigment suppressor. So you're on this program, you might have to buy it twice, and then you go on to a non-hydroquinone program to maintain your results. So we do have 3 different degrees of pigment. For mild pigment, we recommend Bright Alive AM and PM, Ari's favorite. If you have more sun damage, you can use retinol skin brightener and wrinkle and texture repair. But for those of us that have the melasma and the deeper, you definitely want to go on hydroquinone, get a consult, and start looking at more treatments to help reach that melanocyte cell. So I would like to open it up now for some questions if we have any. And I thank all of you that joined us. And if you have a question and you're watching this and it's not live, still DM, and I will answer the questions for either myself, Ari, or Shanae. Forgive me. I have a family member named Shantae, so forgive me. We will be happy to answer your questions. Also, any purchase that's made today, I brought in a little extra incentive. I'm a call to action girl. We have raffle tickets here where your Instagram handle, screen name will be added to that, or if you call in the clinic for purchases. All ZO products, for those of you that watched this today, is 22% off. And that's for those of you that watched it today. What is the date?
The 12th.
The 12th, thank you. 1/12/22, you get 22% off. So nice and easy to remember. And then there's an incentive for those of you that are watching this pre-recorded. I want you to call the office and say ZO15, or give us your DM too, because we have a special coupon for you. So say ZO15 because there's a special incentive if you happen to catch this later. Now I would like to bring on, thank you so
You're
much.
welcome.
Come on over, Cassie. Because we have other beautiful specials for you as well.
Hello.
So Cassie is also come on in here. She is also a dynamic MSN nurse, as well as helps to she runs the practice as well. She is an incredible wealth of knowledge. So any questions that you have too, she can also help you, but she's going to go over the tremendous deals today.
New year, new me. So we are doing Morpheus packages. We do recommend them in a package of 3. So you're going to get $500 off your package of 3.
Hello.
Exactly. So that's face and neck. You're going to get $500 off for your package of 3. And then for your Morpheus body, so you're like, my face and my neck are good, but you know, I want to tighten up my tummy skin, or have a little bit of sagging on my arms. We do Morpheus body. So you're going to get $500 off your package of 3 for those.
Wow.
We also are going to continue to recommend our Zeo products to go with it to continue your results. And for anybody who calls and books today, you're going to have your 22% off of all your Zeo products.
Oh, that is
So
phenomenal.
amazing.
In addition to that amazing discount, anyone that purchases, you get to choose. You can choose from our exfoliation accelerator. This is a 10% glycolic that's going to accelerate your results. If you have dull skin, it's going to give you, I call it the Zeo Glow in the bottle. Also good for congestion. So only while supplies last, you can choose from this one. Or you can choose from the most important thing that I didn't discuss, sunscreen. We don't if you're not going to invest in sunscreen, then just don't even. All your money's going to go out the window.
Sunscreen.
Please wear your favorite sunscreen. And we understand that you have many choices. Wear sunscreen every day, even if it's not sunny outside. San Diegans, we still need it because guess what? Our computer screens, our cell phones are shooting in high energy visible blue light that's also degrading our collagen. So even if you're going to stay inside all day, you still need to wear sunscreen. So we also have, this is a free gift. It's our SPF primer, which is a physical SPF 30. And it comes with a cute, both gifts come with a beautiful bag as well while supplies last. So you get to choose your favorite.
And they're going to pick those up when you come in for your appointment.
Yes.
All right, and then Shanae, because I can't live without my hydrofacials, so I want to share that with you guys. So we're going to do purchase any one hydrofacial, you're going to get your free Zeo product. And then we're also going to do, if you purchase a package of 3 hydrofacials, $100 off, which is amazing.
That's awesome.
I love it. And you get a free booster. So come in, she lays you down, it's so relaxing. She does all this stuff, and then I just wake up and I look glowing, and it's amazing.
I love it.
So you guys gotta come in and do it.
Yes, you have to come in and do it. I wish you could see our faces, but we are being compliant.
I
And we do hope that in the future that we're able to do this in person because we had a really fun day planned. But
exactly.
But hopefully later on this year, if we get a handle on this little COVID
we'll have
thing,
everybody come into the office at once, we'll eat lunch, and we'll do it again. But if not, I encourage you all to give us a call. Get in here for an appointment, and we'll have you have your consults with Ari. We have other aesthetic nurses if Ari's not available, and then we're gonna have you see Shanae for your consult with her, and we'll get your care plan all set for the whole year, ready to go.
Perfect. What's your telephone number?
It's gonna be 858-720-1440. Again, that's 858-720-1440.
Outstanding. And don't forget, please, for those of you that attended live, send a quick DM, even if it's just a heart. Say, hi, I attended live for your 22% off of Zeo. That never happens. So you might as well start the year off right. Zeo never goes on sale. So do that. And for those of you that are watching this pre-recorded, Zeo15, DM that, and you're going to get a special coupon for that as well.
All right.
All right.
I wish I could hug you, but I can't.
I know, but
So,
fist bump.
thank you for seeing us.